Hello, my name is Farina Sheth. I'm a PA. I have my patient here all prepared for the Bby Face facial. I have numbed her for 30 minutes and I have wiped her clean with just some gauze and then alcohol swabs. We will be using the Am Drop and some hyaluronic acid to complete this Bby Face facial.
When you receive your Am Drop Bby Face facial kit, your kit will include Step 1, a 1.0 millimeter professional grade hydroneedle. Step 2, a half cc of Am Drop. Step 3, 3 ml of hyaluronic acid. Step 4 will be your application of the product. Step 5 is our hyaluronic mask that will be applied to the patient for 10 to 30 minutes after treatment.
So this is the hydroneedle. It actually has a little container where I will be mixing my product for the Bby Face facial. It also has needles on top that are gold plated, which will be creating the microchannels that we need for the patient so that the product can be absorbed into the skin. It's very quick and easy. You just twist and open. Then you take your Am Drop just like so, which just twist and open as well. You simply just flip that in there.
Add the half cc of Am Drop into the Integrity Hydroneedle vial.
And you should have nothing in there. Then take your hyaluronic acid that you will be getting in the kit as well, which is 3 ml, and you're gonna put the entire thing in it. And you might get a different kind of container for the hyaluronic acid, which is okay. You might be able to just draw it out with a syringe and put it in. So I'll be putting 3 ml in here, which is what the container has. Very nice and easy. Then I'll just close it back up and just give it a little swirl, just so everything mixes together. And just a gentle flip. There you go. Everything looks nice and clear. And the little bubbles are not a problem at all since this is very superficial. So now we are going to use the hydroneedle that we have our Am Drop and the hyaluronic acid in there. And if you can see, all we're doing is just slowly making these little punctures in the skin so that this concoction can go through and start working for the patient. And the goal is to see this pinpoint bleeding so that you know you're deep enough, and that's all. You don't have to do anything extra in order to actually get the benefits. The best way to do this is just sort of keep up with how your pattern is so that you can cover a really good amount of area. Usually I'll go over it twice or 3 times just to make sure that I have the product in all the areas. My patient is well hydrated, you can see, and you want to encourage your patients to be well hydrated when they come to see you. And we'll finish with this probably in the next 20 minutes. And we'll end it with a face mask. So now I have drawn out the mixture that I had made, whatever was left in my container, and I'm going to apply it on the skin once we are done with all of the microneedling. Our patient did really well. She was very well hydrated. So for the aftercare, I ask my patients, of course, not to be in the sun for 2 weeks while all these beautiful cells are turning over. You don't want those little baby cells to get hyperpigmented with the sun. Also, no sunscreen for 24 hours, so completely stay out of the sun today. It is okay to go in and out of your car or the office, but don't sit next to a window that is going to be that will have the light on your face or any area that you have done this procedure on. Also, for the next 2 weeks, she will be using a special product that has copper peptides and such in it with hyaluronic acid, which will continue to bring hydration to her skin. Microneedling can make you feel quite dry quickly after the procedure, so for the rest of the day she's going to be applying her aftercare gels. So you can see as I am putting everything on her, her skin is looking nice and hydrated. And in a few minutes we will put on a hydration mask, which will further help make things a lot better and the skin glowing. In about 7 days she'll notice a nice glow, texture is softer, you can see a little bit evenness of the skin. In about 3 months is when she'll actually start noticing the little fine lines coming to with the collagen and elastin and getting nice and soft. I will probably do this procedure again on her in about 6 months, and we'll follow up with her in about 8 weeks to see how her skin is doing.